As the number of confirmed cases of dengue fever rises on Hawaii Island, state and county officials are trying to address the outbreak.
There are no jurisdictional issues as far as state versus county versus federal, private. Everybody's working together. Everybody's in support of one another. It's a tremendous team effort.
At what point do we throw out some of the old models temporarily and say, okay, we need to test 500 additional people so we know?
So you
How
bring
do
up
you do
another,
that?
Ray,
Yeah.
another
Kona State Senator and physician Josh Green recorded an interview on Think Tech Hawaii with state epidemiologist Dr. Sarah Park, who is also chief of the Disease Outbreak Control Division.
Our solution right now is, in the acute term, is to try to reach out to all our partners to try to address this issue. It's not going to be perfect, admittedly.
And Lynn Nakasone, who's in the Environmental Health Services Division.
Getting rid of standing water and protecting yourself.
Kona State Representative and also a doctor, Richard Cregan, joined them.
That they could be tested later, they'd identified and tested later so that those people would know that valuable information that they had type 1 dengue or type whatever,
True.
or leptospirosis,
However,
or
it's not
chikungunya.
as simple as that, because we also have population that probably already were infected and, you know, they came from another country, they
Sure.
traveled before.
But they didn't have that
that's-
information.
it
They
just
probably don't have that
It just
information.
becomes that much more complicated. So for the purposes of this outbreak right now, and really the bigger concern is making certain that people who are ill get the appropriate medical care, because frankly, even with an outbreak, I will guarantee you that there are going to be more cases of other types of illness.
Mm-hmm.
And the tragedy would be is if someone actually had leptospirosis, for example,
Right.
which is much more common. And by the way, Big Island always contributes the most cases
Right.
annually of leptospirosis in the state.
Yeah.
You know, so the tragedy would be that that case is missed because everyone is so focused on dengue, and that is a treatable infection.
that-
How would you
but-
miss?
but
How
that
would you
person-
detect that?
If that
case?
person doesn't get tested, so if that person is not assessed fully by a trained, experienced medical professional, and all they're doing is they're interested about getting tested, that, you know, as a physician, if you were presented with a patient and they came to you and said, no, don't pay attention to anything else in my history, all I want is you to test me for this particular thing, and that's all I'm interested in.
Which is not at all what we've been proposing, just so you know. 'cause
Right.
that's been a-
But it's not what I'm
forgive me,
not saying,
Let
but
me finish
yeah.
my thought. This is my program. Okay, Sarah. So that has been a gross and unfair misrepresentation. When I saw those comments, I was quite upset, because what Richard and I and others have said is, right now, for people to understand the Big Island, okay, you have a pretty good understanding. The people that we're speaking of are getting no testing and no health care. So to get any help from a public health official or a nurse or a physician or whomever is, first of all, an improvement.
On Thursday, November 19th, Josh Green and Richard Cregan released an open letter to Governor David Ige and head of the Department of Health, Dr. Virginia Pressler. They're asking for more aggressive action, to include inviting the Centers for Disease Control and the World Health Organization to come to Hawaii Island to provide an independent assessment of the island's dengue outbreak. They're also asking for more access to local testing and more access to health care in specific targeted areas on Hawaii Island during this dengue outbreak.